Welcome, everyone. Today, we will delve into the crucial topic of patient-centered care through a diversity, equity, and inclusion (DEI) lens in graduate medical education. Understanding and respecting the cultural tapestry within our patient population is foundational to providing effective and empathetic care. Cultural competence is not a checkbox, but a journey of understanding, connecting, and valuing our patients' diverse belief systems, values, and practices. Understanding. Culture. Culture is a multifaceted concept influencing our worldview, health perceptions, and interactions with the healthcare system. It's imperative to acknowledge that each patient's cultural background significantly impacts their approach to health and wellness. And as healthcare providers, our cultural competence is pivotal in bridging the gap between different worldviews to provide respectful and responsive care to individual patient preferences, needs, and values. Benefits of cultural competence. Culturally competent care not only fosters a positive patient-provider relationship, but also enhances the effectiveness of care by acknowledging and respecting patients' identities, values, and beliefs. This approach leads to improved patient satisfaction, adherence to medical advice, and overall better health outcomes. Developing cultural competence. Developing cultural competence requires continuous learning, self-reflection, and practice. Engage in educational opportunities. Reflect on your biases. Build trust through effective communication. Engage with the community, and commit to continuous professional development to enhance your cultural competence. Effective communication. Communication is the cornerstone of healthcare. Effective communication with diverse patient populations requires understanding and respecting cultural nuances, breaking down language barriers, practicing active listening, avoiding medical jargon, and valuing each patient's unique cultural identity. Addressing health disparities. Health disparities are preventable differences in health outcomes that adversely affect marginalized groups. Understanding and addressing these disparities is crucial for providing equitable care. Recognize the socioeconomic, racial, cultural, and geographical factors contributing to health disparities and actively work towards minimizing these through culturally competent care, promoting health literacy, addressing implicit biases, engaging in community outreach, and adopting a collaborative approach. In conclusion, cultural competence, effective communication, and addressing health disparities are integral to providing patient-centered care through a DEI approach in graduate medical education. By understanding, respecting, and valuing the diversity within our patient populations, we can provide care that is not only clinically effective, but also culturally sensitive and inclusive. Key takeaways. As we conclude, remember these key takeaways: cultural competence. Commit to developing and enhancing your cultural competence to provide respectful and responsive care. Effective communication. Engage in clear, empathetic, and culturally sensitive communication to foster positive patient-provider relationships. Address health disparities. Actively work towards understanding and minimizing health disparities to provide equitable and inclusive care to all patients. By integrating these principles into your practice, you'll not only be contributing to the well-being of your patients, but also fostering a healthcare environment where diversity is valued, equity is promoted, and inclusion is non-negotiable. I appreciate your commitment to this journey of learning and improvement. Let's create a healthcare system where every patient receives care that acknowledges and respects their unique identity, culture, and needs. Thank you.